Good afternoon, everyone. This is Jim Potter, CEO of the New Hampshire Medical Society, your host for our weekly New Hampshire COVID Vaccine Alliance Zoom meeting. Today is February 16th, and a quick review of our mission, again, is to convene stakeholders across Granite State to promote vaccine confidence, support accurate and consistent messaging, and foster coordination with the vaccines allocation, I should say communications programs. Our goals are to help promote public buy-in of the vaccines to increase immunization rates. We'll talk today more about acting as a force multiplier to support both the vaccine communication and allocation plans of the Bureau of Infectious Disease Control immunization programs. Third, to counter misinformation on the COVID vaccines, and fourth, to promote use of the immunization information system. So a quick recap from our last meeting. You'll recall that if you have problems with second doses, or you have staff members or other individuals, patients that you have, please ask them to call 211 first, and if not, they can email COVID vaccine scheduling. To that end, we have over 3,300 individuals over age 65 or under 65 who are deemed medically vulnerable who've registered as part of phase 1B. This is great news because it exceeds the original estimates for that particular population. My understanding, this information was from midweek last week, so they were having about 1,000 register. So I think we're probably much higher than the 330,000 individuals at this point in time. The other thing is vaccine supply. That has increased from previous weeks from 17,000 to 18,000 doses up to about 25,000 doses per week. And that now includes a new federal partnership with Walgreens, who is distributing through, I believe it's 36 Walgreens locations, 3,400 doses a week, and that will continue. We think from estimates that the number of doses a week will continue to increase as some of the administration's effort to increase supply for both Pfizer or the first two mRNA vaccines have been done. Secondly, Johnson & Johnson, their Janssen vaccine is due to be reviewed. I believe it's next week for EUA, emergency use authorization. Anyway, getting back to the Walgreens, what is different is that actually the state will use their 2-in-1 staff, and they'll be contacting those who are currently registered under phase 1A and B and move them up to potentially scheduled appointments. What we've heard is that sometimes patients don't realize that it's actually the state government calling, trying to move them up. So they're shielding those messages and what forth, but it seems to be moving along. What we're going to, and finally, I just want to, as always, next slide, please, thank our sponsors, Harvard Pilgrim Healthcare, Anthem, Gary Medical Center, Convenient MD, WellSense Health Plans, and New Hampshire Healthy Families. Last slide here, as we said last week, we're going to pivot a little bit and start talking about communications. We think through February, this is a great time to start to push more communications out to various audiences. We're going to focus on this subject for the next 2 or 3 weeks. It's also a good opportunity to go back to some of those individuals in 1A in either nursing homes or in your own medical facilities. For those who are currently hesitant to see if they would reconsider while we still have some space through phase 1 to get them signed up. This will continue again. Again, they can go in further phases, but I think right now, as I heard the information from last week, nursing homes were leading the country with something like a 65% vaccination rate. That may seem low, But other parts of the nation were well beyond or well below 50% in their uptick in long-term care facilities. So I think communications is important. And at this time, I'd like to hand over the stage to Steve Anand and Vanessa Stafford.
Great. All right. So you get the benefit of hearing me, but not seeing me. So that's always a good thing. Now looks like you're gonna unfortunately get to see me as well. So thanks, Jim. Appreciate that. So just want to start off by saying thanks to you and the Medical Society for your leadership in pulling this together, for the work with the Business and Industry Association and many others, to really convene all of the stakeholders on this very, very incredibly important initiative. So as we think about communications, what we're really going to start to do is sort of go back and build on the work that began last summer as part of the Mask Up NH, Mask Up New Hampshire initiative, to really begin to help message the need and the importance of all of the social distancing and other public health messages that Dr. Chan, Dr. Talbot, Dr. Daly, and the commissioner and so many others here in New Hampshire and then across the country have been talking about. And it really was an effort to help normalize and socialize all of those important messages so that we could get back to doing the things that we want to do, so we could help open up the economy. If we continue to mask up, social distance, doing all of those things, we could keep businesses open, and hopefully we could keep schools open and the like. And I think the Mask Up campaign has been incredibly successful, in large part due to the real broad nature and grassroots support that it had. So the Business and Industry Association, the Medical Society, the Hospital Association, and so many others came together and really pushed this out over the summer months and into the fall. And I think the local chambers and business groups really did a great job of helping to message the importance of this as a means of getting them back to work and growing the economy and keeping everyone safe and things moving along. So as we get to this next phase of the COVID effort around vaccination, it really seemed like an important opportunity to really build upon the success of that effort and help to engage, again, on a broad coalition of stakeholders to continue that important message of the importance of getting a vaccine, the importance of what that will do to help end the pandemic, to get us through this, so that we can all get back to normal, or close to normal as we can, given everything that we're dealing with. So you have, I believe you saw the materials that we put out. It really is a launch of this effort, and it really is to build off, and as Jim uses the term force multiplier, I think it's a great metaphor for really what we're trying to do, is to really dovetail with the public health messages from public health, from Dr. Chan, Dr. Daly, Dr. Talbot, and the rest. So again, we're really trying to, really echo those kinds of themes and messages as much as we can, as broadly as we can. We welcome your engagement, your involvement. There's a whole toolkit, and we want everybody to feel, an ownership and ability to use that. So I'm going to stop, and I'm going to turn it over to Vanessa Stafford, who is the Vice President of Communications for the Hospital Association. Has done a lot of work in pulling all of this together in partnership with many others. But Vanessa, let me toss it over to you.
Sure. Thanks, Steve. So I'm going to share my screen here to introduce you guys to the content, but it looks like I need to ask for permission. Sorry. But while we're waiting, I will offer my usual full disclosure in that my second grader is remote today, and he's really engaged in his reading. So if you hear him, my apologies. Okay, Jim, it looks like I don't have permission to share just yet.
Working on it. Bear with me just a second.
Sure, thanks. So while we're pulling up those materials to carry out what Steve had just introduced, we wanted to create an extension of the Mask Up New Hampshire campaign in that we wanted to develop additional materials that would allow individuals and businesses to engage their respective audiences on the safety and efficacy of the vaccine, the benefits of the vaccine, and to really dispel those myths that we know that are out there, and help everyone build or help build additional confidence in the COVID vaccine. So I'm hoping that you guys can all see that sharing now. So together we can keep New Hampshire healthy. This was the tagline of Mask Up New Hampshire. I know many of you that are on this call participated in that as partners, and we just wanted to extend our appreciation for your engagement again. This toolkit is on maskupnewhampshire.com. And again, it just reiterates what I just said about building consumer public confidence, dispelling the myths on the COVID vaccine, and really speaking to the safety and efficacy of the vaccine so that we can help encourage New Hampshire residents to get it when it's their time. These are the materials that we pull together and are providing to anyone who wants to participate within the Sleeve Up New Hampshire campaign. And all of these assets include email templates that you can use within your own business communities, own organizations, your employee base. We have sample op-ed templates and letters to the editor that you can use and customize to your fit. And we have general email templates that you can use that has content for your constituent base or public audience. We also pull together a variety of different email signatures and other graphics that we can use. And then we pulled together a number of different social media graphics that speak to the important tools that we have against the pandemic. Again, reiterating those public messages that we've seen about symptoms, what to do if you're sick. And all of the messaging contained within this toolkit it mimics messaging that we're seeing both out of New Hampshire DHHS as well as CDC as the leading public health experts on the safety and efficacy, what to do, even where to go to get your vaccine. We've got graphics that speak to dispelling the myths and COVID myths versus facts, like I had mentioned. We have graphics that outline the various phases, and we'll be updating these as we go when DHHS gets a little bit closer with their timeframes. And then we have a number of generic graphics, and these speak to protecting those yourself and those around you. They carry out the messaging that was ingrained in Mask Up, and it reiterates all of those of the vigilance of staying true to all of those prevention measures that we know reduce the slow of spread of COVID-19 as well as the community transmission. So Mask Up, Lather Up, Sleeve Up, we really wanted to hold true to all of the messaging and not just make this a vaccination campaign, understanding the personal nature that vaccines are. Again, highlighting it as an important tool in the fight against the COVID-19 pandemic. Again, dispelling those myths. If you've already had COVID-19, make sure that you still get your shot, continuing to wear masks. And then the various side effects that the two vaccines that are out there and available to the public have right now. We've also included a few different messaging kits that can go along with those social media graphics. There's an entire social messaging toolkit from the CDC on the maskupnewhampshire.com website as well. We wanted to make sure that all of the messaging, as I said, was relevant and reflective of what DHHS is already putting out there. We also created some fact sheets, again, that dispel the myths on the COVID-19 vaccine. And again, those social media messages that I had spoken to for a variety of different platforms. There's posters and flyers that are out there that CDC had put out. And then to close it all out, we have a list of additional links and resources. There's a number of other organizations that are pulling together information around the COVID vaccine to encourage their own audiences to get the vaccine when it's their time. So we have a variety of CDC messaging up here. One of the questions that we did have was putting these materials on the website. in their native files so that they could be adapted to suit the audience of your specific business or organization, whether it's an employee, community, chambers of commerce, etc. And we wanted to provide these two different toolkits from CDC about essential workers and community-based organizations. So those links go straight to those toolkits that might help out some of those audiences. And then the Ad Council is working on the COVID Collaborative with a number of different organizations, including the American Hospital Association. And they have specific messaging recommendations, COVID facts, and again, additional materials that address the COVID-19 vaccine hesitation. So we just wanted to make sure that we had those links available for folks. And like I said, all of these materials are on the maskupnewhampshire.com website under the COVID-19 vaccine page. And with that, I'm going to stop my share. And Jim, I don't know if you wanted to open it up for questions now, but we're happy to take any insight, any additional materials that you think might be needed. We'll continue to adjust and add assets to the campaign to make sure that it's reflective of what DHHS and CDC are putting out as we move forward with the learning more about the COVID-19 vaccine.
Thanks so much, Vanessa and Steve. I really do appreciate all the materials that you put together. And again, you can go to the Mask Up New Hampshire website to get those. We can jump into some questions that are coming up. Please, if you have any questions related to this or any of the allocation process, we'll try to address those as we're moving forward. I will just ask the audience at this point, if you know of anyone who's doing some real good work here on communications to any specific constituency, please let me know and we'll have them come on in and present. We've talked to a couple of health systems and maybe we'll come in and have them come in upcoming weeks and talk about it. And we'd also like to begin to target some communications with some particular communities. So whether it's the business community and or clergy and or other kind of community leaders, if you have a constituency that you would like to reach out to or help work with us to develop more of a information campaign that can help promote the vaccine in those communities, we'd be happy to work with you to that end. We do have one question essentially asks whether.
Hey, Jim, before we jump into the questions, I just want to note and just sort of echo your point. I mean, if there are things that are happening out there that people are aware of that we could help connect and sort of leverage one another's collective work, I think that would be great. I know many of us, some of us have met with folks who've been partnering as part of a group called Healthcare Voices of New Hampshire. So a very grassroots effort to sort of be the voice of vaccinations, the importance of vaccination. Many clinicians are a part of that. We appreciate that effort, and to the extent that we can sort of share those messages across those groups, that would be really, really important. And again, there's no pride in authorship here. It's really how do we leverage all the work that's going on here, there, and everywhere to achieve our objective of achieving high levels of vaccination across the state.
Great. There's a multi-part question here that was asked talking about high-risk pulmonary conditions. That condition wasn't actually mentioned overtly in the CDC or the New Hampshire guidance. It lists a number of chronic conditions, including cancer, diabetes, but it's very clear in that guidance that physicians or practitioners have some leniency. They have some flexibility. So if the practitioner believed that that individual was at high risk for if they contracted COVID-19, essentially that they would contracting the virus would hospitalize them, then I think the general what we've told most practices and health systems who've asked, we said, err on the side of inclusion in phase 1B. And those lists aren't perfect. There will be in the state's plan for those that have one condition. Those are really segmented for what would be phase 3A, one condition for essentially getting a little bit further ahead in the process. But it's all risk-based at this point in time. Again, we also know that there sometimes can be disagreements between patients and practitioners on whether the patient qualifies. So again, we've counseled to try to be inclusive as possible, but we realize that no one really wants to promote what we call line jumpers, those who may not even come close to the criteria that the CDC and the state has put forward. But clearly there's neurological conditions that weren't covered under the CDC guidance. So I know some health systems have factored that into their deliberations for essentially testing for medical vulnerability at this point in time. The number was the 325,000 was a guesstimate. And I think it's good that we're actually doing above that number, and we'll continue to do that. Right now, from what my discussions with TW Hull, it looks like they're going to try to have 1B wrapped up by the end of March. They might get that done sooner, depending upon more increased supply and how well efficiently they get that out. But they're going to try to wrap up 1A and 1B by March. So don't be surprised by about mid-March if you hear the governor and others start to talk about phase 2 and actually begin the registration for those, which is a little bit different. In phase 2A, it focuses on teachers and childcare staff. And then it gets into the next age range from 64 to 50 for at risk. So that's part of phase 2 at this particular time. So there's a question there, Vanessa, about the sleeve up in other languages.
Yes, there's actually two. Well, one I'll have your help with. So with regard to the sleeve up materials being translated into additional languages, we have not started that process yet or planned for that, but I know that a variety of different partners are seeking to assist those groups, either within the nursing homes and long-term care facilities or with the diverse populations that you mentioned. So we will look for more information on that and find out where that is and then get back to Jim so that he can share it with everyone. And then with regard to the next question relative to the effectiveness of the Johnson & Johnson vaccine being as effective as the flu, but not as effective as both the Pfizer and Moderna. Again, we can check with our state partners on that, but whatever messaging, special messaging I think will be needed, but that will come straight either from J&J or the CDC to help us guide us in those conversations. So we'll make sure that that's a part of that.
Right now, just to follow on, the clinical discussion is really waiting for the formal presentations that are going to be given to ACIP and then be approved by FDA. So I think you'll hear in the next week or two really a drilling down and a better understanding of that information. What I've seen is what's different between the J&J and the other clinical trials is that J&J was actually in both Brazil and in South America. So they actually dealt, their vaccines have dealt or been comprised of those variants of COVID-19. And so while it did push those numbers down, no one really knows for sure how those two variants are going to impact the mRNA vaccines at this point in time. Although I did see the statistic that for about J&J's, the preliminary information indicates that for serious hospitalizations, still it's pretty close to 100%. So when they use the term 86 or 95, the fail safe on that question in a clinical trial is did you contract any form of the particular virus in this point, COVID-19? However, on both the mRNA and I believe the preliminary information from J&J is that it's very, very small numbers, extremely small numbers on those who were hospitalized after the 28-day period or past 2 weeks past the 28-day period for either the mRNA or the J&J. But again, more of that information I'm sure is going to be teased out in the news reports on the FDA review as we move forward in the next couple of weeks. So any further questions, any other ideas people have, any other things that you would like us to be done? We've talked about, again, developing influencer kits. And I think what you're going to see us do in the next couple of weeks is reach out to some specific communities, particularly in the clergy, to see what we can do to help develop essentially more ecumenical information or ecumenical based information or a way to phrase things about the vaccine. And so, again, if you have specific kind of target populations that you'd like us to work with for that kind of specific information, again, thank you for the comments on making sure that we get information to various languages, particularly Spanish. But there are some other communities that will look to see if we can't have some of these materials developed into those languages as we move forward. So not seeing any more questions right now. Steve or Vanessa, anything else that you have to add this week? Oh.
No, just appreciate the opportunity to continue to connect with this group. It's a great resource for so many.
One last question. Is there a thought about communications materials that would be used by organizations serving seniors? Particularly, we'd be happy to have that discussion with you. So if you want offline to email us, we're happy to take and be able to tailor some of that information. Thus far, the uptake by the phase 1B seniors has, from my information, it's been pretty strong. My guess is it's still there's a number of kind of myths that are out there that we see in the healthcare community, either misunderstanding of what RNA is versus DNA, and how does the virus infect their DNA, which it doesn't. There is other questions about just generally we can help kind of drill in there. So we're happy to, again, if you want to talk to us offline to develop some specific information for your particular organization, we can certainly do that based on the kind of questions and information that you're getting back. One more, according to the New York Times state vaccination dashboard, NIH has received roughly 30,000 vaccinations, but only a little more than 200 doses have been administered. Why is this, and is there a manpower shortage? One, I don't think that there is a manpower shortage per se at the state distribution sites. I'd like to see when that information is, and there's always a little bit of a lag of what the federal government, when the federal government says it distributes, various vaccine to the states and when it's distributed. Keep in mind, there are 3 phases that are going on. One is the federal contract that was with CVS in the state, and that is for long-term care facilities. And we know that that has been slow to get up. And so there's, historically, for the last couple of months, there's been a little bit of a lag there. But I believe that they're trying to get this out as fast as possible. I can't tell you about the Walgreens yet because it's just so new. It really just started this past weekend. So we don't have good information, but we'll do some follow-up and we'll get try to get some accurate information out to you. We will be touching base with our colleagues in the Division of Public Health Services. And if we have additional allocation updates or information that we can share, then we'll be happy to do that. But at this time, I really kind of have to see the particular report and the timing of the report, and then double check that with the state. But overall, I think given some of the glitches that they have in VAMS, they're doing a pretty credible job in getting the vaccine out thus far. So I don't think it's anything on manpower. What I've heard is actually they have a surplus of those who are willing to participate in vaccine sites. I know some health systems are actually joining with public sites and helping supplant that staffing for those efforts. So we'll double check on that, but we haven't heard anything essentially saying that that we're in kind of a dire situation or they're holding vaccine back for any reason. Any other questions that might be out there? Okay. Again, I think the one of the areas that we've seen where we have been lagging as a state has been with the federal contract to long-term care facilities. And again, thank you for that information. And we'll try to get some more specific answers for you next week on that. And if need be, we'll have one of the division staff come back and give you kind of an update of where that stands. But that's some credible questions there, and we'll see if we can't get you some straight information about that. So again, next week, again, we'll probably have some other speakers coming on and talking about some of their communication techniques and their outreach techniques as we're moving. If you know of any particular partners who are doing a great job, let us know, and we're happy to feature in part or whole what they're doing during these calls. And so I think the thrust here is to start beating that drum across multiple spectrums. If you have or are interested in partnering either with the public service information message or others, let us know, and we'll try to coordinate with you or hook you up with other partners that can help, again, kind of amplify that message at this time. So with that, Steve or Vanessa, unless you have some more information, we'll give everybody the gift of time this week, and we'll look forward to talking to you next week.
Excellent. Thank you, Jim.
Thank you.
Thank you. Take care all.